Every drug has its effect, has negative effect, dependence manifestation, and have management way. So there is different types of management. We cannot in this lecture conclude all these drugs, but for simplification we will take some examples for some drugs and taking the most important items about this. This is the main drugs we have in our country and in most of country worldwide. Alcohol is the first group of the drugs, and it is very common to use in several countries, and this alcohol is being consumption in much more amount, even some country making what is called unit of alcohol. It's about 10 millimeter or 8 grams, and this unit it's equal about small glass of wine or half a bottle of beer. And this is conventionally saying that there is a safe limit for drinking, so it means that is 21 units per week for men and 14 units per week for women is a safe, and this should be at least 2 drinking day free. So at least 2 free days are free from drinking, and this is safe. If increase the amount more than this, it leading to dependence on alcohol. Alcohol have several manifestations. The signs, as we say before, it's the same, and we will not repeat here. Alcohol can be manifested for long period, as like we say, alcohol-induced something like alcohol-induced hallucinosis, and there is hallucinations. It means that people hearing or seeing something which is not present. Delusions, it lead like jealousy. Paranoid delusion is also about infidelity delusion, sometimes present in alcoholic patient. Amnestic disorder and Krakow psychosis. Also there is late and residual disorder including depression and dementia. We have a very rapid test for people who are taking alcohol to know what did they become dependent or not, which is called CAGE questionnaire. The CAGE questionnaire is 4 questions. The first one, have you tried to cut down drinking? The next one is, have people annoyed you by suggesting you to do so? And third one, have you felt guilty about drinking? And last one, have you need an eye opener? So during morning you cannot open your eye because of drinking. Answering was yes for any question for this, it means that the people is in risk for dependence. As we say before, it is a figure like this. People has genetic factor for alcohol, and the alcohol is very genetic factors, and availability of alcohol, pressures, peer pressure, and people who have depression, anxiety, psychosis, and impulsivity, all these triggers the people to take the drug for first time and temporarily have the relief symptoms. People feel good, they have social reinforcement to use this several times. After that he cannot stop because there is withdrawal symptom. There is a complication for using alcohol, and we have one of the main complications of alcohol we use is like leading to thiamine deficiency, and in short term there is vernix encephalopathy, which include ataxia, nystagmus, ophthalmoplegia, and acute confusion. And for long period, if people continue for long period, will lead to Krakow psychosis with profound short-term loss and confabulation. Affion or opium is another way, and heroin is the synthetic part of these drugs, and these drugs are working, opioids are working through affecting of mu and the delta receptor, and this action of mu and the delta receptor leading to increase the activity in mesolimbic system and lead to increase the activity of dopamine. Dopamine is increased due to the effect of opioid receptor on mu receptor, and this mu receptor lead to inhibition or stimulation of GABA GABA receptor, which inhibits the release of dopamine. So I inhibit GABA, which inhibits the release of dopamine, so the end result will dopamine release, which become more. And this increase in dopamine leading to the euphoric effect which is needed or which is felt by the addictive people. Usually opium is taken by injection and intravenous injection, but sometimes it is used by smoking or snuffing. Okay, there is many manifestation. Once people taking, there is initial euphoria, feel very happy, and sometimes after he stop, he become disturbed, agitation, retardation, and impaired judgment and social and occupational dysfunction. Pupil is constricted, and it is very sometimes it's like pinpoint pupil, and with increase the dose there is drowsiness, coma with respiratory depression, slurred speech, and this is manifestation for taking the drug. Complication also include hepatitis, HIV infection due to needle exchange or sharing needle with people who taking substance together. Respiratory manifestation like pulmonary edema is a common with the toxicity of use of opiate. Hepatitis like hepatitis B and C, local abscess and site of injection. Thrombosis of the vein is very common. CNS manifestation like coma in overdose, cerebral edema. Perforation of nasal septum is also very common and due to snuffing of this substance. Cardiovascular manifestation, infective endocarditis, renal like nephrotic syndrome, and peripheral nervous system like compression of the peripheral nervous system.